Cancer. It is a scary word that can take your breath away, and sometimes it can take your life. For women who are trying to get pregnant, the ravages of chemotherapy and radiation can also rob you of your ability to have children when that treatment is done and the cancer is gone. But now, thanks to a new study being done at the University of Pennsylvania Hospital, there may be hope for moms-to-be, including a breast cancer patient who now has 19 embryos waiting to become her children.
So we're going to find 19 surrogates and have 19 children at once. No, I'm just kidding. We'll be happy just to have one healthy child.
Yeah. When she was just 34 years old, Cindy Del Giorno and her fiancé Gordon knew they were meant to be parents. But just 6 weeks before they were set to say I do, they learned Cindy had breast cancer.
Then when it came back after the biopsy, they did a lumpectomy biopsy, that it was cancerous. I was beside myself. I mean, I was bawling for days.
Instead of jetting off to a tropical island, the newlyweds spent their honeymoon at the Penn Fertility Center.
Basically, a patient makes an appointment with me, and I review her medical history, pregnancy history, and so forth, and we decide on a plan for fertility preservation. So here I'm showing a picture of the uterus.
There are a number of fertility options for cancer patients. For Cindy and Gordon, freezing embryos offered the most hope for children in their future. And it allowed them to get on the fast track to beating Cindy's cancer right away. It was a race against time.
We really want to move quickly before chemotherapy and radiation therapy has started to do something to preserve the fertility.
We had a short period of time to make a decision because she was going to
We had to do it before chemo started. While my eggs were still healthy, chemo has a 50% chance of ruining my reproductive ability. And that was a process. Needles every day, which I didn't give myself. Thank God for Gordon.
Researchers are still studying what toll cancer and fertility treatments take on these patients. But even after dealing with all the issues, there is hope through the pain. Dr. Gracia says the women have as much as a 40% chance of having a healthy baby with each embryo.
It's very reassuring overall. Even in patients with breast cancer, data has shown that women who get pregnant after breast cancer do very well.
She is invincible. We are invincible because it's made us even stronger. I've said this before, she's my hero.
I think I'm done with cancer treatment. I'll still take a pill every day for the next few years, tamoxifen, and life goes on. In a few years, we'll start a family.
Cindy is strong and she's doing well through her cancer treatment. And she and Gordon are not parents yet, but they are very excited to start a family in the years to come.